This video will tell you how to follow proper hygiene at home and at school. It is very important to watch the entire video and follow what it says. Please teach your children and practice with them at home so when they are at school, they will know what to do. Hand washing is very important. It is one of the best ways to protect you and your family from getting sick. Washing hands can keep you healthy and prevent the spread of the illness from one person to another. Wash your hands often. It is very important to wash your hands before eating or preparing food, after using the restroom, after leaving public places, after blowing your nose, after coughing or sneezing. It is also very important to wash your hands after touching your face mask, after changing a diaper, after caring for someone that is sick, and after touching animals or your pets. Do not touch your eyes, nose, or mouth with unwashed hands. Wash your hands with soap and water for 20 seconds or more. Make sure to wash in between fingers, backs of hands, and fingertips. Sing a song for 20 seconds with children and have them practice so they will be sure to wash their hands properly when they are at school. If you do not have soap and water, you can use hand sanitizer. The hand sanitizer must be at least 60% alcohol. Look on the label to see how much alcohol is in the hand sanitizer. If you use hand sanitizer, cover all of your hands, including the front and back, and rub your hands together until your hands feel dry. Do not wash it off or dry it with a towel. Let it air dry. Children will use hand sanitizer at school. Avoid close contact with people outside your household, especially with anyone that is sick. If possible, keep 6 feet or 2 meters of distance between you and other people and wear a mask. Do not allow visitors into your home unless everyone is well. Keep 6 feet or 2 meters distance with people who do not live in your house. Remember that some people can have COVID-19 and have no symptoms, but can spread COVID-19. Children will have to keep 6 feet or 2 meters away from others at school. Explain this to them and practice it at home. Always wear a mask when you leave your house. You could spread the virus to other people even if you do not feel sick. The face mask is meant to protect you and others from getting COVID-19. Always keep 6 feet or 2 meters between you and others. The face mask is not a substitute for staying 6 feet or 2 meters apart. When a mask is worn, be sure that it covers the mouth and nose and fits securely. Do not touch your face mask with your hands until you are ready to take it off. Then wash your hands first and remove it. Then wash your hands again. Children may be required to wear a face mask at school. The school will provide face masks, or you may send one from home. Make sure that a clean mask is used daily. Practice wearing face masks with your children and teach them not to touch it. Always cover your mouth and nose with a tissue when you cough or sneeze. Throw the tissue away and do not use it again. If you do not have a tissue, cough into the inside of your elbow. Go and wash your hands with soap and water for 20 seconds after coughing or sneezing. If you do not have soap and water, use hand sanitizer with at least 60% alcohol. Teach your children to cough or sneeze into their elbow at home. You can't see germs, so regularly clean areas that people touch with their hands, such as tables, doorknobs, light switches, countertops, desks, phones, keyboards, and sinks. If things are dirty, clean them. Use detergent or soap and water. This will help you and your family to not get sick. Schools will be cleaned regularly. Know the symptoms of COVID-19. Watch for shortness of breath, difficulty breathing, being very tired, muscle aches, headaches, loss of taste, loss of smell, sore throat, cough, chills, shaking, an upset stomach, vomiting, diarrhea, or a fever of 100 degrees Fahrenheit or 37.7 degrees Celsius. If your child has any of these symptoms, you must keep them home from school. A parent or guardian will be required to pre-screen their children for COVID-19 symptoms each day prior to sending them to school. Parents will need to take their child's temperature daily. If your child tests positive for COVID-19, your child must not return to school until 72 hours have passed after the fever is gone, without using any medication. All symptoms are gone, and at least 10 days must have passed since their symptoms first appeared. Students should not enter school if any of the following apply. The child is sick or has been sick in the last 14 days. The child has a confirmed case of COVID-19 or has been in close contact with a person with a confirmed case of COVID-19. These children must follow all isolation and quarantine guidelines and not come to school for 14 days. The child has a household member who is awaiting COVID-19 test results or is awaiting their own test results. Additional screenings may be conducted upon arrival at school and during the school day. Teachers will monitor students and refer them to the nurse if symptoms are present. Anytime your child is absent, you must contact the school to let them know.